You're lying on the ground. It's 8000 BC. You cut your foot 3 days ago, just a small cut, barely even bled, stepped on something sharp while gathering firewood. You thought nothing of it. But now your foot is swollen, the skin around the wound is red, hot to the touch, and there's a smell. Not a good smell, the kind of smell that makes the people around you exchange looks. Your body is burning with fever. You're shivering even though you're next to the fire. There's no urgent care clinic, there's no pharmacy, there's no doctor who's going to prescribe you a Z-Pack and send you home. There's just you, your infected foot, and a very real possibility that you're going to die from what started as a completely unremarkable injury. And yet, somehow, you don't die. Your ancestors didn't die. Because if they had, if even one of them had succumbed to an infection before reproducing, the entire chain that leads to you sitting here right now would have snapped. Gone. No you. No this video. Nothing. So the question isn't academic, it's personal. How did ancient humans, with zero understanding of germ theory, with no antibiotics, with none of the medical infrastructure we take for granted, survive infections that should have killed them? The answer is more sophisticated than you think, and in some ways more relevant to your life right now than you might expect. This is the story of how humans survived bacterial infections before modern medicine, not occasionally, not by luck, consistently enough that the species made it through 300,000 years of cuts, wounds, broken bones, childbirth, and disease without penicillin, without sterile surgical tools, without even knowing what bacteria were. We're talking about survival strategies so effective that they kept humanity alive through the entire span of prehistory, and why some of those strategies are now being rediscovered by researchers desperately trying to solve a problem we created ourselves. Because here's the thing nobody tells you. Ancient humans didn't just passively hope infections would go away. They developed genuine medical knowledge, passed it down across generations, and in some cases, discovered the same antimicrobial compounds we use today. They just found them 10,000 years before we figured out the chemistry. Let's start with the thing that sounds grim, because it was. Before antibiotics, a huge number of people absolutely did die from infections. There's no romanticizing this. The archaeological record is full of skeletons showing signs of fatal infections. Osteomyelitis, bone infection visible in skeletal remains, shows up across ancient burial sites worldwide. Septic arthritis, abscesses, infected compound fractures, all of it killed people regularly. Maternal mortality from postpartum infections was staggeringly high. Dental abscesses killed otherwise healthy adults, and in many cases, there was nothing anyone could do. The infection spread, the fever spiked, and the person died within days or weeks. That was the baseline reality. But, and this is the important part, not everyone died, not even most people from minor injuries. The human immune system, it turns out, is genuinely extraordinary. It evolved over hundreds of millions of years to fight infections without any external help. And for the vast majority of minor bacterial infections, cuts, scrapes, shallow wounds, the immune system handled it on its own. When bacteria enter your body through a wound, your immune system responds in stages. White blood cells flood the area. Inflammation begins, which is why the wound gets red and swollen. That's not a malfunction, that's your body sending an army to the site of the breach. In most cases, for most of human history, that army won. The bacteria got cleared, the wound healed, the person survived. No intervention required. The infections that killed people were the ones that overwhelmed this system. Deep wounds, wounds in areas with poor blood flow, wounds complicated by foreign material embedded in tissue, infections in immunocompromised individuals, or simply infections caused by particularly aggressive bacteria. But the fact that anyone survived infections at all before we understood what we were fighting is because evolution had already built the primary defense system directly into our biology. Now, here's where it gets interesting. Ancient humans didn't just rely on their immune systems and hope for the best. They observed patterns. They noticed that certain things seemed to help wounds heal, and others made things worse. And over thousands of years, they accumulated a body of empirical medical knowledge that, while not scientifically understood at the time, was genuinely effective. Let's talk about honey. In 2007, researchers analyzing ancient Egyptian medical texts, specifically the Edwin Smith papyrus dating to around 1600 BC, found repeated references to honey being applied directly to wounds. The Egyptians weren't guessing. Honey, it turns out, has legitimate antimicrobial properties. It's highly acidic, with a pH between 3.2 and 4.5, which inhibits bacterial growth. It has low water content, which creates an osmotic effect that draws moisture out of bacterial cells, killing them. And many types of honey contain hydrogen peroxide, produced naturally by an enzyme called glucose oxidase. Modern medical research has confirmed all of this. A study published in 2011 in the European Journal of Clinical Microbiology found that medical-grade honey was effective against antibiotic-resistant bacteria, including MRSA. Another study in 2016 showed that honey could prevent biofilm formation, the slimy protective layer bacteria create to shield themselves from antibiotics. Ancient Egyptians were applying this to infected wounds 3,600 years ago. They had no idea why it worked, they just knew that it did. And they were right. Honey wasn't unique to Egypt either. References to honey as wound treatment appear in ancient Greek texts, in Ayurvedic medicine in India dating back over 3,000 years, and in traditional Chinese medicine. The same observation made independently across multiple continents. That's not superstition, that's empirical medicine. Then there's garlic. Garlic contains a compound called allicin, which forms when garlic is crushed or chopped. Allicin has broad-spectrum antimicrobial properties. It's effective against bacteria, fungi, and even some viruses. The ancient Sumerians, around 2600 BC, referenced garlic in medical context in cuneiform tablets. The ancient Greeks, particularly Hippocrates, the guy modern doctors still reference when they take their oaths, prescribed garlic for infections, parasites, and digestive issues. He wasn't making it up. A study published in 1999 in the journal Microbes and Infection demonstrated that fresh garlic extract inhibited the growth of multiple strains of antibiotic-resistant bacteria. Ancient humans, by trial and error, had identified one of nature's antibiotics and were using it therapeutically thousands of years before Louis Pasteur was even born. But perhaps the most fascinating example is mold. In ancient Egypt, China, and Greece, there are references to applying moldy bread or moldy organic material directly to infected wounds. To a modern observer, that sounds insane. Putting mold on an open wound seems like exactly the wrong move. But some molds produce penicillin. That's not a coincidence. That's literally where we got the antibiotic. In 1928, Alexander Fleming famously discovered penicillin when he noticed that a mold contaminating one of his bacterial cultures had killed the bacteria around it. The mold was Penicillium notatum, the same genus of mold that grows on bread. Ancient Egyptians weren't doing controlled laboratory experiments, but they noticed that sometimes when moldy substances were applied to wounds, the wounds healed better. They didn't know about penicillium, they didn't know about antibiotics, but they knew what worked. And in some cases, what worked was accidentally dosing patients with a naturally occurring beta-lactam antibiotic 3,000 years before we gave it a name. Let's talk about something that rarely comes up in these discussions: wound care. Because before you even get to the question of antimicrobial substances, there's the basic question of how you treat an injury to minimize infection risk in the first place. In archaeological evidence, combined with observations of modern traditional societies, suggests that ancient humans were surprisingly sophisticated about this. First, cleaning. Washing wounds with clean water, or in some cases with wine, beer, or vinegar, appears across ancient medical texts. The Edwin Smith papyrus explicitly describes washing wounds. The ancient Romans used wine and vinegar extensively. A study published in 2014 in the journal MBio tested ancient Roman wine for antimicrobial properties and found it was effective against several bacterial strains. The alcohol content and acidity made it a functional disinfectant. Did the Romans know about bacteria? No. Did they know that washing wounds with wine reduced infections? Yes. Empirically, observably, yes. Second, removal of foreign material. Ancient surgical tools, bronze, and later iron instruments for probing wounds and removing debris have been found at archaeological sites dating back thousands of years. The Hippocratic corpus, a collection of ancient Greek medical texts, includes detailed instructions for wound debridement, that is, cutting away dead or contaminated tissue. This is still standard practice in modern emergency medicine. Dead tissue is a breeding ground for bacteria. Removing it dramatically improves healing outcomes. Ancient Greek physicians figured this out through observation and practice. Third, immobilization and rest. Keeping an injured area still, preventing further damage, and allowing the body to heal is basic, but it's also critical. Ancient bone-setting techniques and splints, some dating back to ancient Egypt, show a clear understanding that immobilizing a fracture improves outcomes. When you reduce movement, you reduce further tissue damage, which reduces infection risk. Now, let's tackle something genuinely brutal because it was. Amputation. When an infection in a limb became severe, spreading, visibly necrotizing the tissue, ancient physicians in multiple cultures performed amputations, not as a first resort, not casually, but as a last-ditch effort to save the patient's life by removing the infected tissue before the infection spread to the bloodstream and became systemic sepsis. And some of those patients survived. We know this because we found healed amputation sites in skeletal remains. In 2007, archaeologists in France discovered a skeleton dating to approximately 7,000 years ago, a Neolithic period burial, with a healed forearm amputation. The bone showed clear evidence of surgical cutting and subsequent healing, meaning the person survived the procedure and lived for years afterward. Think about what that means. 7,000 years ago, someone performed a limb amputation without anesthesia, without antibiotics, without sterile tools, and the patient survived. The infection risk from the surgery itself was enormous. The pain would have been unimaginable, and yet it worked, enough times that it became an established, if desperate, medical practice. Ancient Indian Ayurvedic texts describe amputation procedures in detail, including the use of cauterization, burning the wound with hot metal to seal blood vessels, and, incidentally, kill bacteria with heat. Ancient Chinese medical texts describe similar procedures. The Roman physician Celsus, writing in the 1st century AD, detailed amputation techniques, including tourniquets to control bleeding. These weren't experimental guesses. These were refined techniques passed down across generations of practitioners who had learned through grim experience what worked and what didn't. Here's another angle most people never consider: heat. Fever is not a malfunction, it's a feature. When your body detects an infection, it deliberately raises its internal temperature because many bacteria are temperature sensitive. A sustained fever of 38 to 40 degrees Celsius, 100 to 104 degrees Fahrenheit, slows bacterial reproduction and enhances immune system function. Ancient physicians observed this, and in some cases, they intentionally induced fever to fight infections. The use of sweat lodges, hot baths, and steam therapy appears in multiple ancient medical traditions. The ancient Greeks used therapeutic baths. Native American sweat lodge ceremonies, while spiritual, also had physiological effects, including inducing sweating and raising core body temperature. Some traditional African and Asian medical practices involved wrapping feverish patients in warm materials to encourage sweating. Modern research has validated parts of this. A study published in 2011 in the Journal of Leukocyte Biology found that fever range temperatures enhance the ability of certain immune cells to travel to infection sites. Moderate fever improves outcomes for some infections. Ancient healers didn't understand the immunology, but they observed that patients who developed fevers sometimes survived infections that killed others. So they worked with it rather than always trying to suppress it. The instinct to break a fever at all costs is actually fairly modern. For most of history, controlled fever was seen as part of the healing process. Now, here's where we arrive at the uncomfortable part of the story. We figured out antibiotics in the 1940s. Penicillin became widely available. Bacterial infections that had killed people for all of human history suddenly became treatable. Pneumonia, sepsis, infected wounds, all of it could be cured with a pill or injection. It was miraculous. It saved hundreds of millions of lives. It's one of the greatest achievements in human history. And we're in the process of destroying it. Antibiotic resistance, the evolution of bacteria that can survive antibiotic treatment, is accelerating. The CDC estimates that in the United States alone, antibiotic-resistant infections cause more than 2.8 million infections and 35,000 deaths every year. Globally, the number is vastly higher, and the trajectory is getting worse. We overprescribed antibiotics for decades. We put them in livestock feed to promote growth. We used them for viral infections where they do nothing. And bacteria, doing what bacteria do, evolved. MRSA, methicillin-resistant Staphylococcus aureus, is now common in hospitals. CRE, carbapenem-resistant Enterobacteriaceae, is resistant to nearly all available antibiotics and has a fatality rate of up to 50% in some infections. We are sliding backward toward a world where common infections are once again potentially lethal, and researchers are desperately looking for alternatives, which brings us full circle. Some of those alternatives are the same things ancient humans were using. Honey is now sold as medical-grade wound dressing in hospitals. Maggot therapy, using sterile raised fly larvae to clean infected wounds by eating dead tissue, is making a comeback in modern wound care. It sounds medieval because it is. Ancient texts reference it, but it works. And when antibiotics fail, what works matters more than what sounds modern. So how did ancient humans survive deadly infections before antibiotics? The honest answer is many of them didn't. The mortality rate was high. Childbirth, injuries, and disease killed huge numbers of people in ways that would be easily preventable today. But the ones who survived did so because of a combination of factors: a robust immune system honed by millions of years of evolution, empirical medical knowledge accumulated over thousands of generations, passed down as tradition and practice, the use of naturally occurring antimicrobial substances, honey, garlic, certain molds, wine, vinegar, discovered through observation and trial, sophisticated wound care, cleaning, debridement, immobilization, brutal but sometimes effective surgical interventions, including amputation and cauterization, and in many cases, sheer genetic luck. Some people's immune systems were simply better equipped to fight certain infections than others. What's clear is that the knowledge wasn't random, it was systematic. Healers in ancient Egypt, Greece, India, China, and indigenous cultures worldwide developed overlapping medical practices because they were observing the same human biology and discovering what worked. That knowledge was valuable enough to be carefully preserved and taught. And when modern researchers actually test these ancient remedies, they frequently find that the chemistry backs up the practice. The gap between ancient healers applying honey to wounds and modern surgeons using medical-grade honey dressings is smaller than the gap between ancient healers and doing nothing. There's something genuinely humbling about realizing that for 99% of human history, people survived infections using tools that would fit in a small bag: plant extracts, clean water, heat, and careful observation. No labs, no pharmaceutical companies, no randomized controlled trials, just accumulated knowledge and a species-level determination to survive. The oldest medical texts we have, the Edwin Smith Papyrus from Egypt, the Hippocratic writings from Greece, the Sushruta Samhita from India, all of them describe wound care and infection treatment in detail. This wasn't fringe knowledge, it was core to survival. The healer who knew how to clean a wound, which plants to apply, when to cut, and when to wait, that person was as critical to the group's survival as the best hunter. And the thread that runs through all of it is observation. Ancient humans didn't have the scientific method as we know it, but they had something close. Try something, see if it works. If it works, do it again. If it works repeatedly, teach it to others. Refine it, improve it, pass it down. That process, repeated across thousands of years and millions of individual healers, built a body of medical knowledge that genuinely saved lives. Not perfectly, not always, but often enough that humanity survived long enough to eventually figure out germ theory and synthesize antibiotics in laboratories. Next time you take an antibiotic for an infection, you're participating in something far older than you realize. You're continuing a fight that humans have been waging against bacterial infections since before we were recognizable recognizably modern. The tools have changed, the understanding has deepened, but the fight, the fundamental biological struggle between human immune systems and bacterial invaders, that's been going on for as long as we've existed. Your ancestors fought it with honey and garlic and fire-heated bronze. You fight it with amoxicillin. The battle is the same. And if we're not careful, if antibiotic resistance continues to spread, we might find ourselves reaching backward into that ancient toolkit once again, not because we want to romanticize the past, but because when modern tools fail, the things that worked for 10,000 years start looking a lot more relevant. The ancient healers who figured out that honey prevents infection, that garlic fights bacteria, that cleaning wounds saves lives, they didn't have degrees, they didn't have labs. What they had was observation, experience, and a refusal to accept that infections were simply acts of fate. They fought back with every tool they could find, and some of those tools are still worth remembering. You're alive because thousands of generations of humans before you survived infections long enough to reproduce. That's not an accident. That's evidence of medical knowledge, crude by modern standards, but effective enough to matter. The smoke rising from ancient fires carried the scent of medicinal herbs. The hands that cleaned wounds didn't understand bacteria, but they understood care. And somewhere in that unbroken chain of survival and knowledge, there's a healer who treated an infected wound on one of your direct ancestors and did it well enough that the person lived. You're the proof it worked.